Well, good evening all. Thank you very much for joining us this evening. We're very, very lucky this evening to have Chris Wright talk to us this evening about no foot, no horse, forelimb issues. So I'll hand over to Chris, and thank you very much for all joining us.
Evening, everyone. Yeah, thank you for taking the time to join us this evening. The title of my talk is, as you know, No Foot, No Horse. It's a fairly far-reaching talk, and if there are any questions at any time, please jump in, and Lee will pose them to me. If people who know me know I can talk the hind legs off a donkey or a horse, so I will try and keep it brief. Let's go. If there's anything, if there's anything anybody wants to know, please give us a shout, and I'll try and answer the questions if I can. So let's have a quick recap of the anatomy of a horse's foot. I'm sure most of you know this, but there may be some that are unfamiliar with the terms that we use. So on the left is a sketch of a horse's foot. We have the frog in the middle with a central frog cleft. They call it their frog groove, but we would call it a frog cleft. I think the interesting thing about frogs is the horn of a frog is slightly different to the rest of the foot. It is very soft, it's very spongy, and actually in the wild, the horse's frog does bear weight, and it's like a shock absorber. But as you probably noted from when your horse is shod, if it is shod, often the frog doesn't touch the floor, and so that's something that we need to consider when we shoe horses. For those of you who've been unlucky enough to need heart bar shoes for any reason, you'll see the idea of a heart bar is it does start to spread the weight onto the frog, which is really important because it helps to support the whole bony column. And for those of you who have thoroughbreds, this area here and here is quite important. This is what we call the seat of corn. Corns are just bruising of the solar horn, but they get it in these areas here, particularly in thoroughbreds because of the shape of the feet that we will talk about later. The picture on the right is clearly not a thoroughbred. There's quite a lot of feather there. This is a cob with a nice shaped foot, quite a nicely trimmed foot. And I think the other structure I would like to point out to you is this structure here. Ironically called the white line, which in this horse is black. It's often black, and that's because it tends to collect dirt. But the significance of the white line from a vet's point of view and a farrier's point of view is it's the junction between the sensitive and insensitive parts of the foot, and basically it glues the wall of the foot to the pedal bone. And so it's a really, really important structure, and we will come back to talk about that later on. If we then slice through a horse's foot, I think the areas of interest are obviously the bones, the long pastern or P1, the short pastern, which we call P2, and the coffin bone, which we as vets call P3, or the third phalanx. You'll see this thing here called the digital cushion. The digital cushion is important because that's the soft spongy material that's beneath the frog, and that's what gives the horse's foot that suspension. Many horses with abnormal foot shapes, that digital cushion is crushed or squeezed out of the back of the foot, and they do lose the suspension in the foot, which is really important on hard ground because it can cause concussive problems in the rest of the foot. The other things I think that are of significance are this structure here, which is the navicular bone, this structure here, which is the deep flexor tendon, and then the laminae down the front and the laminae on the sole of the foot. We'll come back to all these structures because they're all really important from both a veterinary and a lameness point of view. So if we think about foot conformation, because conformation is really important when we look at a foot and when we look at a horse, because anything that affects the foot will affect the rest of the limb. And the common foot abnormalities or foot conformation problems that we see are boxy feet, and I think we see those particularly in Spanish horses or some very young horses that have had chronic lameness. We see very, very commonly collapsed heels, and I think that's especially common in thoroughbreds and anything that's related to a thoroughbred. We can see abnormal growth rings, and we can see an abnormal hoof pastern axis. And I will talk about each one of those because they're all really, really important. So when we think of the hoof pastern axis, there are three classic states that we consider as vets. There's normal on the left, where basically the dorsal wall of the pastern and the dorsal wall of the hoof are all in line. We have what's called a broken forward hoof pastern axis, where the dorsal wall of the pastern is at a different angle to the dorsal wall of the hoof, and it forms this angle here. This is reasonably unusual in our population, but we do see it. We would see it particularly in Spanish horses. And then we have this, which is much more typical of a thoroughbred type horse, a broken back hoof pastern axis. This causes problems for all sorts of reasons, because it can cause the heels to collapse. It can cause the toes to become overly long. It brings what's called breakover too far forwards, and that puts strain on the deep flexor tendon that runs down there, and that in turn puts pressure on the navicular bone, which is there driving the navicular bone that way into the coffin joint. Broken back hoof pastern axes are very common, but they're not necessarily very easy to treat. So this is a horrible broken back hoof pastern axis with also collapse of the heels. You can see here, this horse has nearly no heels. The bulbs of its heels are almost on the floor, and the toes appear abnormally long. The problem with this horse is, from a farriery point of view, how does a farrier correct this problem? It's not at all straightforward. What he might do, or what lots of farriers will do, is they will put quarter clips on. So most front feet have a toe clip, but what a farrier may do is put quarter clips on. By putting quarter clips on, that allows him to move the shoe backwards, which is really helpful. But the problem we have is we get a lot of pressure here on the heels, and that causes the heels to collapse still further. Really, really difficult to manage. What we can do is some people will put wedges on these horses. That is a very quick fix, but is often detrimental because it will put even more pressure on the heels than we've got already. The other way of managing it is to what's called float the shoe, and that's to leave the shoe attached at the toe and then pare away the horn here. That's great, but often farriers don't like doing that, because what you'll find is your horse's shoes keep falling off, or they keep flipping them off. And then you say, well, my farrier is no good, his shoes keep falling off. And so that is really tricky, really, really tricky. And I don't necessarily have an answer as to what to do about that. But it is something to watch out for when you're buying a horse, and when you're assessing a horse to with its foot conformation. It's really common. This is an extreme example of abnormal growth rings. So what do we mean by growth rings? What's a normal growth ring and what's an abnormal growth ring? Normal growth rings occur when we get speeding up or slowing down of the hoof growth, which in a normal horse is associated with usually with changes in pasture. You know, if you have a few sunny days, the grass grows, the horse eats a bit more grass, and its foot grows a little bit faster. And the normal growth ring is parallel all the way around. Oops, sorry, all the way around here. These lines appear as parallel lines because the hoof at the toe is growing at the same rate as the hoof at the heel. You can see in this example that that's not the case. What we've got here is we've got a lot of growth at the heel and nearly no growth at the toe. The reason for this is this horse is a chronic laminitic. And so what's happened is the coronary band at the toe has been crushed, so it can't grow because the blood supply is compromised. Whereas the coronary band at the heel is not compromised, and so it grows very quickly, and you get this bizarre shape to the hoof. The heel grows quickly, but then sort of moves forward, and you end up with this long toe. If we x-rayed this horse, almost certainly the horse's pedal bone is sat here like this, rather than down there, which is where you think it would be. I hope that makes sense. And this is something we wouldn't see very often. This is a very boxy foot, so it's a very upright foot. We'll see this, as I say, sometimes in Spanish horses or some growing horses where, particularly if they've had a lot of lameness, the heels will grow quite a fast rate, and they'll give them this sort of boxy appearance to the foot. If we're given a horse like this, what we can do is trim the foot or get the farrier to trim the foot. But what we don't want to do is take this heel off in one go. If the farrier takes that heel off in one go to create a normal foot, quite often what can happen is you end up with a horse that doesn't put its heel to the floor at all, because what we need to consider in these cases is that the tendons that support the foot have also often shrunk as well. And so if we just trim the foot off in one go, you'll end up with a horse that bears all its weight on its toe, and the heel just sort of hangs above it, and that can make them very, very sore. And in fact, that can go on to cause further tendon contraction, and the boxy foot may actually deteriorate. So if we do try to address a foot like this, we need to do it very slowly, probably over 2 to 3 shoeings. The other things we need to consider, and this is really important when we consider, I think, laminitis, and some people still will walk a horse with laminitis, and I think it's categorically the wrong thing to do. And the reason for that is, if you have a horse that's stood still that weighs 450 kilos, which would be the average weight of, let's say, a thoroughbred, the ground force on each front foot is about 1,350 newtons. And a newton is a tenth of a kilogram. So about 135 kilos goes through each front foot when they're just stood still. If you walk them, as they take one foot off the floor and move forwards, that increases the weight through one foot to about 2,800 newtons or 280 kilos. So that's over double immediately. And if this is a galloping horse on the left, in a galloping horse, the weight through one foot can be up to 10,000 newtons. So over twice the body weight of the horse through one foot. Now, if you've got a laminitic horse or a horse with a sore foot, that's an awful lot of stress to put through those laminae, up to 6 to 7 times what it would be if you just stood them still. And if those laminae are compromised and weak, that is a surefire way to tear them. They may be able to damage laminae, may be able to take the weight of a horse if it's just stood still. But if you start to move it around, that may be too much, and they'll actually start to tear. And that's why, particularly laminitics, we need them to stand them still. Really, really important. This is really weird talking. It feels like I'm talking to myself, but I hope you're all listening. I hope you're all can stay with me. So how does weight get transferred through a horse's foot? Well, we have the weight of the horse coming down the bony column into the bones, because that's obviously how the weight's transferred. The weight all goes through the pedal bone. The pedal bone then transfers that weight across this area here, the laminae, to the wall, and then the weight continues this way. So that's why the laminae are absolutely vital. They're incredibly strong structures, but if they're damaged, we need to protect them. We need to take the weight off them as much as we can. So we need to keep these horses still. What then happens is the weight of the horse is transferred from the bony column onto the hoof, and then the hoof bears the weight on with the ground. In theory, the solar surface of a foot here should be concave, and it shouldn't bear any weight. The frog in this region should bear weight, and as should the wall all the way around the foot. So all the weight of the horse is basically transferred from the pedal bone down to the hoof wall and then onto the ground surface, with a little bit of addition from the frog. The other thing that happens in a horse's foot is they have a pull from this structure here called the deep flexor tendon. As a horse walks, what the pedal bone wants to do is get driven that way by the ground force. what stops the pedal bone going that way is this deep flexor tendon, which is pulling it that way. So as you can imagine, there's an awful lot of tension in the deep flexor. And that in turn puts pressure on the navicular bone, which drives the navicular bone forwards into the back of the coffin joint. That's normal, but if we have an abnormal foot conformation, those tensions can be that much greater and the pressure on the navicular bone can be that much more, which is why it's really important that your farrier, a good farrier will try to balance the foot to equalize those pressures within it. And that can in itself help prevent diseases such as deep flexor tears and navicular disease. I'm just going to check the time. Okay. So when we think of horses and their feet, it's really, really important that we appreciate that about 90% of forelimb lameness is in the foot. And if we accept that, we then need to consider what sort of horses get what sort of disease. So the horses on the right at Cheltenham are very unlikely to be chronic laminitics. They may well fracture their pedal bone, but they're unlikely to get laminitis because they're just not the right sort of horse. The horse on the left, sweet as he is very overweight, is very unlikely to go to Cheltenham, but is very likely to get laminitis because that weight is excessive, and he may well have a condition we call metabolic syndrome, which we may touch on later, but I say I've got quite a lot to talk about and I can rattle for Britain if I need to. So we need to consider, we need to accept that most forelimb lamenesses are in the foot, and that we then consider what's the horse's shape and what's it used for, and that might give us a guide as to what the likely diagnosis is going to be. So quite often, having said that, I will go out and look at a horse and lots of people say my horse has a sore shoulder, and I will immediately think, no, it's probably got a sore foot. And there are things that we do as vets, which I think is quite important for us to pass over, as things we do as vets to ascertain that the horse is sore in the foot. And I will quickly go through some of these things for you. So the first thing we would do is we would look at the foot, just stand to the side and look at it. I hope you can all agree that this, from what's gone before, this horse's foot is not a great shape. This horse's foot has a broken back hoof past an axis because it has an angle here. And also we talked about wedges. This horse has a wedge inserted in this foot, and it has a quarter clip rather than a toe clip. So this horse has a broken back hoof past an axis with collapsed heels, and what we've tried to do, or what's the attempt has been to try and raise the heels with a foot wedge, but probably that wedge has caused increased pressure on the heels and has made them collapse more. I don't know if you can appreciate these horn tubules, these lines are running forwards rather than running down. We would like the horn tubules to run that way, but I think in this horse, they're running that way. And so they're getting crushed. The farrier's made a decent attempt to bring the breakover point backwards because he's applied quarter clips. But in this case, we have been unsuccessful, and we may need to do something more radical, such as float the heel, or even put a special shoe on, maybe a bar shoe or a heart bar shoe. Another thing I'm sure you've seen us do is apply hoof testers. Hoof testers are basically just a way that we can apply focal pressure to a horse's foot. What we must remember is that it applies, as you can see in this example, it applies pressure to both the sole and the wall. And it's really important that we test the whole foot. And if we're not sure, we need to test both front feet, because some horses will have a particular focal sore spot, such as Puss or a nail bind. Some may just have generally sore feet, like a laminitic. And others, you may be, as a vet, you may be thinking, well, is it sore, isn't it? I'll just check the other foot. So we can compare one foot with the other, but hoof testers are really, really useful. And I'm sure you've seen most of us use them. The other thing that I would very much like to talk to you about is feeling digital pulses. If any of you do have laminitics and we're there, please get us to demonstrate how to find the digital pulse. It's a really, really useful thing to be able to do. And if you have a lot of horses or you run a yard, it'll take us 5 minutes to show you how to feel them. And it's a really, really good indicator that a horse has a sore foot, because although it may not give you a specific diagnosis, if you've got a bounding digital pulse, you know that something below that digital pulse is sore. It's a throbbing pulse. Now, I know from talking to clients, often they find it very difficult to feel them. But what you must appreciate is the horse's heart rate is quite slow, and a fit thoroughbred might have a heart rate as low as 25 beats per minute. A normal fit horse may have a heart rate of probably 30, 35 beats per minute. And so it can be quite difficult to feel these, but we will quite happily show you them. But what I do know for certain is if you've got a bounding digital pulse, your horse has a sore foot. It's a really good guide. The other reason this is there is sometimes you may or may not have seen us use nerve blocks. The idea of a nerve block is that we put local anaesthetic around the nerves that supply the foot. And if your horse has a sore foot and we take the sensation away from the foot, the horse will go sound. And this is also the site we can block the horse's foot, where those red markers are. They have two nerves, a nerve that runs down each side at the back, and they supply all the sensation to the foot. So if we put a little bleb of local anaesthetic on the left and the right side, it will lose all sensation in his foot, and that will give you a guide as to whether he has a sore foot or not. We may, if we're not sure, we may take an x-ray. It's fairly clear that this horse's foot is not normal because it's got a nail stuck in the back of his foot, and we've got some more pictures of horses with nails in their foot, which we will talk about later on. And if we're really not sure, we can move to what's called MRI, which is called magnetic resonance imaging. MRI is expensive, relatively, compared to the other tests, but it's really, really good for looking at soft tissues. Before MRI appeared, before we had MRI to look into horses' feet, really all we could do was x-ray them. But as we've seen on the preceding slides, there's a lot more to a horse's foot than just bone. There's a lot of important soft tissues, particularly the deep flexor tendon, but also what's called the synovial structures of the foot. So there's the navicular bursa, which is just here, and the coffin joint, which is just there. And the best way really to look at those is with MRI. A lot of the time we don't need to, but it is there as a reserve should we need to get more detail. Okay, so now we're going to look at some cases. When we think of diseases of the foot, and in fact any disease at all of a horse or a person, we're taught at university to think of things as either infectious. So if we think of an infectious disease of the foot or an infected disease of the foot, the obvious one is pus in the foot. It could be a metabolic disease such as laminitis. It could be a traumatic disease, so an external blow to the foot like a pedal bone fracture. It could be a degenerative disease where things have started to wear out, such as arthritis. Or it could be what we call idiopathic. Now, idiopathic is a great word because it basically means we don't know what causes it. And I've put in there a disease called a keratoma. Some might argue that they do know what causes keratomas, but I think idiopathy or idiopathic is a great way to describe keratomas. I'm just checking my time again to make sure I'm not rambling. Okay. So, pus in the foot. What do we think about pus in the foot? What I think about pus in the foot is it's very common. It will usually make your horse very lame. And I think of pus in the foot as two conditions really. We can have pus down here, down the dorsal wall, and that will tend, they don't always behave like this, but tend to make your horse exceptionally lame, and they often have only a very small amount of pus in there. The reason that I think they're so lame is because if you imagine what happens when we get pus or infection, we get swelling. Well, down the dorsal wall, it's got nowhere to swell because to one side we've got the coffin joint or coffin bone, the P3. Now that's bone, that's not going to swell or move out of the way. On the other side we've got hoof wall, and that's not likely to give very much either. So when you have a little bit of pus in here, it starts to swell, but it's got nowhere to go. So you get a lot of pressure, and this makes these horses very, very sore, but often they're very small amount of pus. The other place we can get pus is under here. This is called a subsolar abscess, so beneath the sole. Now, these horses are also quite lame, often not quite as lame as when they're up the dorsal wall. But the other thing about these is, as the pressure builds up underneath the sole, often the sole will give way a little bit, and that will release the pressure, and the solar abscesses will often spread. And sometimes when we dig those out, we can get lots and lots of pus out. It's really, really, it's why I went to vet school, really, to dig pus out of horses' feet. It's the most rewarding thing we ever do. Lancing abscesses and squeezing spots is just great fun, and it's the reason to be a vet. Anyway, so we get little pus here. We often get a lot of pus under here. So this horse had a dorsal wall abscess, and you can see that it's burst out around coronary band. Abscesses along the dorsal wall will always track in one direction. They always track up, and they track in straight lines. And that's because it follows the track of the laminae within the foot. And the laminae run up and down the dorsal wall. So you'll always get them tracking directly upwards. And you can see it's burst out here, but probably if we turn this foot upside down and looked here, we would have a track running all the way from there up this wall up here. And as I say, the other place we will get them is in their sole. And this horse has what we would describe as seedy toe. And like I mentioned earlier, seedy toe, the white line is an area of weakness. And what's happened here is that the white line has separated, and we've had dirt and gravel been driven up the dorsal wall. And this can make horses very lame. Lots of these other horses are actually quite sound, and every now and again they'll go a little bit sore because they have a little bit of pus build up, but it drains through this gravel that's in the bottom. And the only way to manage these is to dig all that out, flush it out, and then pack it. The other thing to say about these is, obviously, as you can imagine, that often gets hidden beneath the shoe. So you may not actually appreciate that it's there until you take the shoe off. They're usually quite easy to manage from a vet's point of view and from a farrier's point of view, but as I say, they're not always obvious that they're there. And the other thing we need to consider is what happens to a horse that's had pus in the foot. As time goes on, if it's burst out at the coronary band, we get these marks, you get these defects in the whole hoof wall. This defect is a result of pus in the foot, which happened that long ago, which for me in this normal horse is probably about 4 months ago. So a horse will grow a whole new foot within 9 months. So I think that's probably 4 months ago. So this horse, I can say to people, oh, was your horse very lame 4 months ago? And they say, oh, yes, he was. How do you know? Well, we know because this horse has had pus in his foot about 4 months ago. This is a timeline, basically. And this is the result of a chronic subsolar abscess. What's happened here is the vet or farrier has dug away at the sole. You can see how much it's underrun the sole and how much sole has been removed. And underneath that is what we call a false sole. Well, actually, this is the real sole. The false sole or the underrun sole has been removed. This horse has probably been lame on and off for a long, long time, but every time the pressure builds up in that foot, the sole just separates a little bit and the pressure is released, so the horse isn't quite as lame. And they're also very, very pleasing to treat because you often get a lot of fluid out of those horses. Okay, so some conditions of the foot. Is this thrush or is this something else? The image on the left is a horse with thrush. Thrush is usually a managemental disease. It's because the horse has been stood in dirt or dirty bedding or urine-soaked bedding or the feet haven't been picked out properly. And it's quite easy to treat. It usually occurs on the frog or in the frog clefts. The frog clefts are there, there, and there. As you can see, that one's missing because this is a thrush case. Lots of people say, how should I treat thrush? I think the easiest way to treat thrush is to keep your horse's feet clean, keep the bedding clean and dry. If it's very bad, get your farrier to cut away the thrushy frog. And then if you're desperate, you can, with a little toothbrush, brush bleach into the frog. Be very, very careful that A, you don't get it on the skin, and that B, you wear some eye protection, because the bristles of your brush will squirt bleach everywhere. You'll end up with spotty jeans with little white spots on it. And also if you get it in your eye, you'll certainly know about that. It'll make you wince a little bit. But thrush generally is quite easy to treat. And a bad thrush can look like the condition on the right, but the condition on the right is something far more sinister than thrush, and it's called canker. Now, the exact cause of canker is unclear, but certainly mild canker does look like thrush, and it's quite easy to get caught out by it. Thrush is very common. Canker, in my experience, is really quite rare. Thrush on the left is easy to treat. Canker on the right is frustrating and difficult to treat, and is definitely not a fault of management, or certainly not to my mind, it's not a management problem, although they do need very careful management once the diagnosis is made. Canker is a disease, usually affects hind feet more than front feet, but it can affect all feet. It usually affects the frog first, but it can affect the sole. And the odd thing about it is sometimes you look at the frog and you think, oh, that must be really painful, and sometimes they're not that painful, and it melts away almost like cream cheese, and you can scrape it away with a fingernail. You can cut the frog away with your fingernail. Very, very strange condition. But if you do have something that looks like that, it does need prompt veterinary care, because they're not easy to treat. The way we treat them with topical antibiotics, or at least I do, and often systemic steroids, because this is probably actually a systemic disease rather than a local disease. It just manifests itself with this proliferative foot thing that looks like a severe thrush, but it's not.
Chris, I'm just going to ask you a question there that a lady has asked, is why do some horses get repetitive faults? Is there a problem with the coronet?
Do they repetitive what, sorry, Lee?
So why do some horses get repetitive faults? Is there a problem with the coronet?
Well, if they get the cracks running down horizontal cracks.
What I'm going to do is, obviously, while you can hear me, I'm going to ask that for Roz, if she doesn't mind, as she was the lady that very, very kindly asked the question. Unmute Roz and ask Chris.
Hi, Chris. Thank you.
Hi, Roz. How you doing?
Yeah, really good. I was just wondering why some horses seem to get like a repetitive fault that just occurs at the same place in the foot. I obviously understand if you've had an abscess there, but is there like a weakness in the coronet? Is there?
Yeah, I mean, I think you can definitely get weakness in the coronet if you've had a crack that runs all the way up. I think the other thing about them is often they look like they've healed, but they haven't. If it's a vertical crack along the dorsal hoof wall, you can get a weakness in the hoof wall, which it starts to heal, and then all of a sudden will start to split again. I think if they're horizontal cracks, that probably represents a disease of the coronary band itself, or as we'll see later, there are some other conditions that can cause repetitive pus in the foot, which may not be obvious at first, but later becomes obvious there's something going on. But yes, I think it's a weakness in the coronary band if you keep getting it, or there's something undiagnosed within the foot.
Thank you.
You're welcome.
Thanks, Roz. Cheers, Chris. Sorry to interject.
So as we've said, if we need to look into a foot, we have two great ways of doing it. Well, probably three. We have X-ray on the left, very good for looking at bones and foot balance, and we have MRI, which is not particularly good at foot balance, but really good at looking at soft tissues. We do have a third modality for looking at feet, and that's called CT, or computed tomography. The problem with CT is they need a general anesthetic. It's very good for looking at bone, and probably it's reserved for us for fixing fractures. If we had a pedal bone that's fractured that we wanted to fix, we may put it through the CT scanner, and that will give us a beautiful 3D reconstruction of the foot and all the bones within the foot. But it's not something we would use routinely. But generally, X-rays and MRs are the two best ways of looking at horses' feet.
Chris, before you go on to the next bit, we've had a very good question. Someone has asked whether canker can spread to other hooves, and also can all injury cause issues?
Canker, if you've got canker in one foot, it's really important you just check the others. It's usually worse in one, but it often occurs as pairs or all fours, I'm sad to say. And sorry, what was the other question, Lee?
And the other question was, and also, can old injuries cause issues?
Old injuries to the foot or the front?
I suspect both, really.
So I think as far as canker is concerned, we don't really know what causes canker, and also what's quite odd, it's very common in Belgium for some reason, and it's not really that common in Britain. It's much more common in heavy horses and cobs than it is in thoroughbreds. Although actually the last one I treated is in a thoroughbred cross, which is really, I think, quite unusual. Generally speaking, if you think your horse has got canker, it's probably got bad thrush.
The actual question was not pertaining necessarily, we've had some more information, was not necessarily pertaining to canker, but old injuries to the foot themselves. Can that cause issues? I presume therefore that maybe, you know, whether we've got damage to a coronet maybe, and therefore can that cause a problem?
For sure. If you've got damage to a coronary band, be it a cut or a traumatic injury, that can definitely cause abnormalities of the hoof, which in some cases will never resolve. You can end up with a horse that has a persistent crack. So if you have a, let's say, a wound that involves the coronary band where we've lost a little bit of coronary band tissue, the reality is you will probably get a hoof defect that is there for the rest of the horse's life. It may be manageable, but it's not always manageable. And sometimes farriers or vets, we will suggest with a coronary band injury that we brace the foot with metal plates, and it's incredible how intolerant metal plates are. Have been on a horse's foot. They snap quite quickly, and you realize quite what a dynamic structure a horse's foot is and how strong they are. And most of the materials that we have to repair horses' feet are not as good as the real thing. They're just not. But anyway,
that's brilliant, Chris. Thank you.
We have two X-rays here. I hope they've come out on your screen, and I'd just like to just talk through them with you. So this is a horse. One of these horses is intermittently lame and has been for quite a long time. The image on the left is a normal horse's foot. What we can see on this foot are the pedal bone. I can't point at it with my finger. Is here. The navicular bone is there. The pastern bone is there, and this is the coffin joint. The way a horse's foot has a blood supply is really cool. There are two blood vessels that run down here, and they go around here, and then they come back up. So this is called the terminal arch in a horse's foot, and they send these branches off. You see these channels, each one of those has a blood vessel in it. And as you can see, the picture on the left, it's quite nice, it's very smooth, we've got lots of vascular channels, and we've got a smooth outline to the pedal bone itself. The picture on the right is similar. We've got the same structures, we've got the coffin joint here, we've got the pedal bone here, we've got the navicular bone there, and we have the terminal arch here, and we've got some vascular channels here and here. So just the same. But on this view, we don't have a smooth outline to the pedal bone. We've got some bits missing. Something has dissolved this horse's pedal bone. And surprisingly, well, not surprisingly once you see them, some horses can get infected pedal bones, and that's exactly what this looks like. The reality of the natural history of these horses is they present as very lame. They get pus in the foot. we or the farrier dig it out, or you poultice it and it bursts out, and everyone's happy for a short period of time. And then the pus comes back, they go very lame again. We do the same again, gets better again, then goes lame again. But all the time, the reason they keep getting pus in the foot is because they've actually got an infected pedal bone. And that's this structure here. We can see these areas that have dissolved away from the pedal bone. It sounds quite dramatic, it sounds quite awful, but actually we can manage it. But what we need to do is take away the damaged pedal bone. So what we need to do, what we tend to do is we tend to anesthetize your horse's foot. We would like to do these standing. We will anesthetize your horse's foot, and we talked about how to do that earlier on. Where you find the digital pulse, we can put local anesthetic in there, take all the pain away from your horse's foot, and then we need to dig the pus out, but then we keep digging. We keep digging down to pedal bone, and we dig. I'm going to try and remove that if I can. Oh, no, I don't think we need subtitles. So we've dug through the sole here, and we've dug and dug and dug, and we've dug all this dead bone away. This is it's quite an invasive thing, and you can get quite a lot of bleeding. And so a lot of these horses, we will put a tourniquet on to stop the bleeding. But afterwards, they'll often do very, very well. They'll certainly do a lot better without that dead pedal bone in there than with it. And then we will apply what's called a hospital plate, which is a shoe, a complete shoe with a metal plate on the bottom. If you just excuse me, I'm going to try and get rid of these subtitles. Okay. Great. So yeah, so that's what we would do with an infected pedal bone. There's another disease that can look a little bit like an infected pedal bone that isn't, and this was on my list of diseases which we would describe as idiopathic, and that's called a keratoma. I'd like to show you an X-ray of this. So this horse presented a little bit like the horse before. It kept getting pus in his foot. He kept digging it out. It kept getting better. And then a few months later, it would go lame again, and it got pus in its foot. And on very close examination, we can see here's the white line, which again, ironically, isn't white. It's pigmented because it's full of dirt, because it's a soft area. And then we can follow the white line around here, and all of a sudden we've got this thing in the white line. Here's the white line there, and we have a structure sat in the white line. The way I would think of these structures, this is called a keratoma. It's like a wart. Now, when we get a wart on our finger, it grows out. But like we said with a hoof, the hoof is fairly strong structure. So if you have a wart within your hoof, it tends to push inwards, and we get something that looks like this. On X-ray, we end up with a big defect in the pedal bone. This is different to an infected pedal bone. Do you remember the infected pedal bone looked very irregular and it was ill-defined? We've still got the blood supply down to the foot in this terminal arch. We've still got these vascular channels, but all of a sudden in the middle we've got a big piece of pedal bone that's missing. But the edges of the pedal bone are really, really sharp. And that's because this hasn't been eaten away by infection. This has just dissolved because of the pressure of that wart pressing on it. And the way I tell my kids about it, because occasionally they do listen to me, but not that often, it's like a U-shaped valley. Now, what I know a member of the audience is a geographer, so don't correct me if I'm not right about U-shaped valleys, but I think U-shaped valleys are caused by ice moving down valleys and carving out the valley bottom. And that's the way I think of keratomas. They carve out a beautiful channel down the pedal bone. Now, if we don't do something about this keratoma, it will continue to grow, and the horse will continue to get repeated bouts of pus in the foot, and you'll be just about to go to a competition, and your horse will go lame again. So in reality, we need to cut out this structure, and the way we will do this, we will cut a window into the hoof itself. So here, they go in order. Here, the surgeon has an oscillating saw, and he's cutting out a window in the wall of the hoof. Once he's cut down almost to the laminae, he will scrape the laminae. And can you see here? He's scraping it here, and down here, he's actually cut out a window down onto the laminae. These are laminae. And can you appreciate that here, there's an indentation within the laminae, and that's where the keratoma sat. It's like a wart, and it grows down all the way down the laminae. You could say, but Chris, you've not removed it all. You've not taken all the hoof wall, because we could cut the whole thing down there, because the keratoma will extend all the way down. The reason we would choose not to do that is because if we remove all that hoof wall, we tend to destabilize the horse's foot, and it can make them exceptionally sore. So we try to cut a window here and also a window in the sole, and we will put what's called a curette all the way up and scrape it out, and try to leave as much wall here as we possibly can, because that gives the foot some support. These horses are actually very comfortable with this procedure, but if we remove the whole of the dorsal wall, that can make them very uncomfortable very, very quickly. So we try desperately not to do that. Historically, we did do that, but now we try to preserve as much foot as possible.
Hi, Chris. Chris, we've had a question from Charlie, has asked, do you ever get bone cysts in lower limbs?
So yes, you do get bone cysts, and a bone cyst will tend to be something that's articular, so it communicates with a joint. And what a bone cyst is, it's where the joint itself, which is usually a very smooth surface. I'm just going to go see if I can go back a slide. Let's go here. So if we just take that off. So here is the coffin joint here. It's a smooth structure. It's what's called a synovial structure. So it has cartilage in it. It has cartilage on this bone, has cartilage on this bone, and it has what's called synovial fluid between it. A bone cyst is where we get an outpouching of the joint, which would do that. It's not especially common in distal limbs, certainly not in the foot, but we do get them. And the problem with them is no one's quite sure exactly why horses get them, but they fill with synovial fluid. And the typical history of a bone cyst is that your horse is sound and all of a sudden goes very, very lame. And it's thought that the reason they go very lame is because they squirt fluid into the cyst. And that puts pressure on the bone, which should never have pressure on it, and makes them very lame. You call the vet, say, my horse is three-legged lame. By the time we get there, sometimes they're actually sound again, because the lameness can be very, very transient. But once you've called us a couple of times or told us the history, my horse keeps going very lame, and by the time I do anything about it, he's gone sound again. That flags up bone cysts. That's what bone cysts tend to do, but they're not that common in the distal limb. You can get them, but they're more common in, let's say, stifles particularly is a classic site for bone cysts. I hope I've not rambled too much. Yes, you do get them. They're not very common.
That's great. Thanks, Chris.
All right. Now, I could talk till next Christmas about laminitis, because it's one of my pet subjects, probably because I think laminitis is very common. I think it causes an awful lot of suffering in the sort of horses we see. And I think there are so many things that we can do to try and help these horses. And so I will just check the time to make sure I don't ramble for too long. How am I doing for time, Lee?
You have to also give me time as well to unmute.
Okay, all right. Okay.
Yeah, I would say if we could start thinking about drawing to close, that'd be great, Chris.
Okay, so I'm going to really crack on then. So laminitis, obviously really common. The classic cause of laminitis are Cushing's disease, metabolic syndrome, which is a fat pony syndrome, or toxic. And that would be typically post-foaling, where if you get an infection in the uterus or endometritis, could cause severe and acute laminitis. The other cause of laminitis are the things where they've already got laminitis and we think they're better and they're not. So exercising a laminitic is a bad thing for all the reasons we've said earlier. And also,
I'm going to stop you mid-flow, Chris, just because I don't want to go too far into laminitis while we haven't come far from keratomas. We've had a question. How do they actually determine the margins in order to remove a keratoma?
So the margins of a keratoma actually make life a bit easy for you because they can almost just drop out. The margins are defined itself by the keratoma, and then you can scoop them out whole if you're lucky. And they are bizarre, horny lumps which you can scrape out. So they almost define their own margins.
That's brilliant. Thanks,
Whereas
Chris.
a septic peelbone, infected peelbone, it's difficult to define the margins. You scrape until you get blood and healthy tissue again.
That's superb. Thanks.
This horse, I'm sure you'd all agree, has Cushing's disease. He looks quite old. He looks actually quite happy, but he's rocking back. He's taking his weight on his hind limbs, trying to take it off his forelimbs. And not surprisingly, when we x-ray his foot, he has this sort of conformation. So this is a classic laminitis x-ray, but there's more to it than that. So this marker is along the dorsal wall. Here's the dorsal wall of the hoof. Here's the pedal bone. And I'm sure we can all appreciate that this is not parallel to that. So the toe is long and we have a V shape in here. The other thing that's interesting about this, if someone showed me this, I'd say that horse has had laminitis for a long time. The way we can tell that is because this pedal bone is not a normal shape. He's got this slight ski appearance to the tip. And that's because over months, if not years, this pedal bone has been bang, 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 bang on the sole as it's been walking, and that's made the pedal bone remodel. And so that's something we'll see quite a lot, actually, in these old chronic laminitics. As you tell, I'm rushing now. The other thing we need to consider are nails in the foot or bursa penetrations. This is something you should no one ever does ignore a nail in the foot, but our worst nightmare is a nail that goes through the middle of the frog, because right in the middle of the frog is there, right in the middle of the frog is this structure here called the navicular bone. Overlying that is the deep flexor tendon. And if you get a nail that does that, we've got big problems. These horses absolutely need surgery. They don't all survive. They don't all get better, but they definitely don't get better with antibiotics. These horses need surgery, and the way we do surgery in these is we put a scope, an instrument actually down the back here into the bursa there, and we flush saline through that joint. Obviously pull the nail out and try to tidy it all up, but it's really not a good thing to have. This is the horse having that surgery. This is where the nail went in. We've pared away the hoof to try and make it tidy, and you can tell the horse is asleep. It's in theatre, and it's got these instruments down the back of the pastern, actually into the what's called the navicular bursa to flush it out. I think that probably even with quick surgery, it's 50-50 as to whether your horse will survive this. It's a really, really nasty injury. I'm approaching the end. Pedal bone fractures. This is a pedal bone fracture. This pedal bone fracture goes straight up the middle and enters the coffin joint. It's the thing that governs whether pedal bone fractures do well or badly is, does it involve the coffin joint, and is it displaced? This does involve the coffin joint, so the outlook for this horse is not great. Probably 70 to 80% of horses like this will come sound, which does leave a significant proportion that don't. But if you have a fracture that affects the wing, for sure they'll come sound. They'll do really, really well. We have a number of ways that we can fix these horses, and an articular fracture we may actually put back together with a screw. The way we do that is to cut a hole in the hoof wall and drive a screw through the pedal bone beneath the hoof wall. And then we end up with something that looks like that, with a screw in it. Why do we put a screw in it? Is because it will help to stabilize the fracture. It'll stop the fracture moving. Is it the be all and end all? No, it's not, because we can also treat them with casts or bar shoes. This is a cast applied with just some casting material, and this is a bar shoe. As you can see here, the fracture is now very, very obvious. And what's interesting about pedal bone fractures, I think is interesting, is that if your horse gets a pedal bone fracture, in 12 months, it will still look like it's got a pedal bone fracture, because they never heal with a bony union. They heal with what's called a fibrous union. So they get fibrous tissue that bridges them. So they always look fractured, but they, if they don't involve the joint itself, will often do very, very well. I know I've got to the end. If anyone has any questions, please post them to Lee and we'll try and answer them for you. And thank you for listening. I say it's really weird sat here in my office. I can't tell whether you're listening or not because I can't see anybody, but I hope you've enjoyed it. As I say, if there's any questions, fire away. Thank you.
Chris, we have a number of questions, so bear with me just for a minute while I kind of dig some through. We've had one as an email question. It's about angular limb deformities and how best to support them. It's actually given in context to a case. I won't, for client confidentiality, I won't say, but so I'll edit a little bit. My horse has a turnout from the knee on his off fore, and the farrier is shoeing him appropriately. But I would like to know if there is more I can do, i.e. would boots or bandaging play any role as his workload starts to increase?
So this is a question we're asked quite often, and I would categorically say it's really important your farrier keeps on top of the foot, but I don't think anything else makes any difference. I don't think bandages are strong enough to offer significant support, and I think the most important thing is don't try and correct it. We have to work with what God's given us. If your horse's foot turns out, we'll live with that. We just need to make sure that sometimes if you imagine a horse's foot turning out, we can end up with abnormal wear on the inside of the hoof, and that can start to collapse, which makes the situation worse. So it's really important your farrier supports the foot with a shoe, but don't try and correct it with a shoe. Don't try and turn your foot back in with a shoe, because I think that will often, if anything, make them lame. We just work with what we've got and try and balance the foot as best we can and stop it wearing abnormally. That would be my attitude. What do you think, Lee?
No, I think that's absolutely fine. I think I would reiterate that wholeheartedly. We have another few questions to try and get through, so I'm going to jump to the next one in case I miss it. So the first one we have is, why are the feet where toxins flush to?
That is a super question. Okay, I think the answer to that is it isn't. Obviously, if we think of the horse with the post-foaling mare that has a uterine infection, what's called endometritis, what we often see is the whole horse becomes poorly, but then your horse gets laminitis. I think the reason for that is the lamini, the blood supply to lamini is enormous, so you have a big blood supply to the feet, but also they're such strong structures. If they become compromised in any way, you see the signs much sooner. So endometritis and toxic endometritis is a systemic disease, but it is just reflected in the feet, as your email or caller says. But I think that's just because the feet are just so sensitive. And I think the other thing about them, which is a bit complicated, but basically, if we think of a horse's foot and our fingernails, a horse's foot and our fingernails are attached quite tightly to our hands, and yet they grow. So there must be some mechanism by which the horse's foot can detach from the pedal bone and yet reattach. Because if it was just permanently attached to the pedal bone, it couldn't move, it couldn't grow. And so there are some really quite interesting enzymes that live in the laminae in the foot, which the horse can turn on and off in a controlled manner to allow the foot to grow. And probably the reality is that horses that are toxic, these enzymes get turned on out of control, which detaches the foot. from the pedal bone, and so the foot starts to move, starts to rotate, and that's probably how laminitis starts in these horses. But it's basically because the foot has a great blood supply. But yes, it does appear that the foot's affected preferentially. Yeah, it's sad but true.
And then the lovely lady that asked that question has also asked, can you block that enzyme reaction?
Who asked that? That's a great.
It's a bloody good question. It's a very good question. And most of the questions this evening, I'd like to say thank you to Ros, because she's asked most of the lovely questions. We do have some from others as well. But
so yes, there are drugs available which do. The enzyme that we're talking about, if anyone's interested, they're called matrix metalloproteinases. And yes, there are inhibitors of matrix metalloproteinases on the market. The sad reality is when we turn an enzyme on, that doesn't hurt. So you don't actually realize your horse has laminitis, because in fact it's not sore. All that's happened is those enzymes have been turned on and we don't see it. And so, but by the time the horse is sore, it's all too late. But yes, there are inhibitors of matrix metalloproteinases available, and one of them is actually an antibiotic that we use all the time, which will turn them off. But you need to give it before you realise your horse is laminitic. So we can give it in the case of a toxic horse, because we can reasonably predict that the horse may become laminitic, and we can use it in those circumstances. And quite a lot of research has been done into it. I don't think anybody's proved that they really work, but certainly theoretically in a test tube they do work. So yes, but the problem is you need to use them before you realise your horse is laminitic, and that's the problem. It's the same.
Thank you, Chris.
Putting your horse in an ice bath. You need to do it before your horse is laminitic, because by the time it's laminitic, it's too late.
So then we're going to change tack slightly, and the question was asked is, what is your view on barefoot? And is there anything that we should look out for with these issues? I'm going to go back. I'm going to ask the question as he's written it. Hi, just wondering what your view is on going barefoot for health, and if there is anything we should look out for that we could be any issues. Maybe I'm not reading that, and maybe in the way he wanted me to say it.
Okay, so I think this is actually an enormous topic, and I don't put myself forward as a foot expert, but what I would say is I think the barefoot is fine if your horse has nice feet. The reality of many horses in the UK, particularly thoroughbreds, is they don't have nice feet, and I personally tend to get a bit of a nosebleed if people try to barefoot trim thoroughbreds, because I think they have a habit of going wrong. I think if you've got a native breed with nice feet, I think it can work really well. And also we need to consider, what are you doing with your horse? If you're running your horse up and down roads a lot, then I think they need help and support with shoes. I think if your horse is doing lots of schoolwork or around in a field and it's a native breed, I think barefoot trimming works really, really well. I think if you've got a thoroughbred, I think most of the time it probably doesn't work well. And then we've got the sort of the hybrid situation where lots of ponies will be shod in front and not shod behind, and I think that works well. That's what I think about it. Yeah, if your horse's feet are nice, I think barefoot trimming is fine. I think if you've got a horse with abnormal feet or imperfect feet, I think probably shoes are very helpful.
Great, thanks, Chris. And then we have another one as well. I won't say who this one's from, not to embarrass her again. Why, if the frog is so important for foot function, do we shoe a horse with the frog not touching the ground?
I think I don't necessarily have the answer to that, but what I would say is that people who like barefoot shoeing and barefoot trimming, there are good reasons to do barefoot, particularly the frog bears weight. But what we must appreciate is we do lots of abnormal things to horses. Horses were not meant to work on roads or tarmac, but we do that. And that's where I think shoes come in. And I think also, if you think of a horse working on a very hard surface, the shoe protects the foot. And the reality is that the whole surface is very hard, so the amount of concussive protection you get from a frog is very small. But if you've got a horse that's shod out in a field, the reality is the frog will hit the ground because the horse will sink into the ground, and also on a school as well. So yeah, we do abnormal things to horses. Most of the problems horses have are caused by what we do to them more than anything else.
Great, thanks, Chris. Is there anyone else that has any other questions that want to pass it on the chat? And Ros, no, you keep asking away. Well, it appears that either people are slow in typing or not wishing to ask.
Sorry, sorry, it's Lou here. Can I butt in, because some of the questions are coming through to me, and it's probably easier for me to just ask them, Chris, rather than try and type them onto Lee. So one from Jeffrey, who asks, what is your preferred way of treating canker?
Okay, so the flippant answer is I prefer not to see them because I think they're really difficult. But if I am presented with one, I think there are some important things to do with them. I think we need to pare the frog back as much as we possibly can and cut away as much of the diseased tissue as possible. Now, that can make horses in the short term really very sore, and I think it can cause quite a lot of hemorrhage. Once we've done that, once we've cut it back as much as we dare, I like to apply an antibiotic called metronidazole. It's a little bit of a quirky antibiotic. We don't use it very often. And I think systemic or topical steroids are also very important. We need to keep the feet meticulously clean. I don't think canker is a management disease. I think there is some inherent abnormality within the foot. But getting it infected definitely does not help, which is why we use antibiotics. But yeah, so I like to pair them. I like to keep them meticulously clean, and I like topical antibiotics and topical steroid, possibly systemic steroid in the short term. And then going forward, I tend to use a mixture of both, something to keep the frog a bit soft with steroid and antibiotic in it, and something to make it a little bit harder, which often for me is a zinc sulfate or formalin. But it's one of those things that if you'd like to give us a call to discuss, because it's such a niche thing, most people will not see a horse with canker, and thankfully it's quite rare, and we could talk about it all day. And I don't necessarily think there is a right or wrong way to treat it, but I think meticulous attention to hygiene is vital. But I don't think it's primarily a hygiene problem.
Yeah, and there are so many treatment options for it because it's just so damn difficult to treat.
It is, yeah.
And I think the etiology of it as well is so variable that that's why we have to use a multitude of antibiotics, because not one antibiotic seems to cover all for it, which is such a shame.
Have we got
but I think the antibiotics are important, but it's not primarily a bacterial disease. There's some inherent problem with the hoof or the horn itself, which then secondarily becomes infected. But I don't think it's primarily a bacterial disease. I think it's an inherent abnormality of the horn that is produced.
Just another question from Jane. My horse had a sudden onset of laminitis from which he recovered quickly. Blood tests reveal no issues. Can he now return to low-level work?
So I think the answer, if it was an acute laminitis, I think if the pedal bone has not moved and the horse has got better, I think it's really important we check it's not moved, then I think 3 weeks is plenty. Many horses do have some subtle movement of the pedal bone, and I think that puts a completely different complexion on the situation. Horses with rotated pedal bones can go sound also quite quickly, but I think if you work them too soon, they will then start to tear the hoof wall away from the pedal bone, and that will turn your horse from an acute laminitic into a chronic recurrent laminitic. I think it's really important you get some x-rays, particularly if it was acute and came on out of nowhere, before you return to work. I'm not plugging B&W too much, I hope, but we do foot x-rays for laminitics. I think they're about 140 quid for a pair, so then hopefully they won't break too many banks. But it's much better than end up with a chronic laminitic.
Sharon has asked, dare we mention foot balance?
Yeah, foot balance, like we said at the beginning, is really, really important. Foot balance doesn't just affect the foot, it affects the whole way the limb works, and it changes the way they bear weight on all the joints, also the tension in the tendons and the ligaments of the leg. Foot balance is vital. But what I would say is, if your horse, like someone asked about, my horse got turned in foot, don't try and trim the foot to turn out or to correct an angular limb deformity, because I think you'll just make your horse lame. We just need to work with the way your horse is. If we can change the foot shape with farriery, that's great, but don't change the foot shape to try and change a leg conformation, if that makes sense. Foot balance is vital, but it's not always easy to manage. A good farrier is worth his weight in gold, and some patience.
And then just a couple of points. Simone said, I have been very interested in what has said, but going back to barefoot, I have a thoroughbred and he has been barefoot for 4 years. My farrier always gets very excited about his feet. My horse has very strong feet. So I think it was just...
I would say, in my defense, your thoroughbred is very lucky. He would be the exception rather than the rule. I think thoroughbreds, in my experience, often have bad feet, and the way I would explain that is, most thoroughbreds are meant to run fast, and they run fast when they're young. So a thoroughbred can run fast with awful feet when they're young, because it's not taking its toll on the rest of the limb. But when they're older, and certainly when they come out of racing and they're taken on by people as hacks and show jumpers and things, their feet are often in a terrible state. But I think if you've got a thoroughbred with nice feet, that's fabulous, and you should breed from it, because I think many of them have awful feet. And I think awful feet probably need remedial shoeing, for me. But if you've got perfect feet, that's great.
And what is your opinion on plastic stroke glue on shoes, and how beneficial are they for injury rehab?
Glue on shoes are very expensive. They wear very quickly. They are difficult to apply properly. They are fantastic, I think, in the right situation. So we would tend to use plastic shoes in foals that have foot abnormalities, where we're trying to correct a foot balance issue in a growing foal. I think glue-on shoes are fabulous. I think in an adult, I would tend to reserve them for laminitics that are desperate. I think they are helpful because they don't have the pain of driving nails into the foot, and you can help to support the frog with them. But I don't use them very often, and they are expensive and they are difficult to apply properly. But they are good.
Thank you. And I think this is a last question I've had, unless Lee's had any more, but how can you tell the difference between laminitis and bruised soles? And then if you have a puncture wound in the foot, what is the best first aid to do until you get the vet there?
So how do you tell the difference between a bruised sole and laminitis? I think it's very difficult. You would tend to say most bruised soles that are acute often be one foot rather than two. Most laminitics are 2 feet. I think the reality is, if in doubt, you treat it like it's laminitis, because if you're wrong, it doesn't matter. Whereas if you said, oh, it's just a bruised foot, I'll put a bandage on it and turn it out. If it's laminitic, you could do a lot of harm. So I think you treat it like laminitis until proven otherwise. What you'll often find with a bruised foot is they're sore in one particular space, whereas laminitics tend to one particular place with hoof testers, whereas laminitics tend to have a sore arc in front of the frog with hoof testers. But I think clinically, you can't tell the difference between them. And actually, some chronic laminitics do get bruised soles anyway, because their pedal bones are banging on their soles. Sorry, the question, what would I do with a solar penetration?
Yeah.
So what I would do with a solar penetration, if you've got the foreign body still in it, if you can, and this sounds a bit dramatic, is leave it in, bandage the foot and try and leave the foreign body in. I know that a lot of the times that's not realistic. If you can't do that, please put a mark on the sole where it went in for us. And then poulticing it, I think, is absolutely fine, and get the vet to have a look at it. Most solar penetrations do not involve the navicular bursa, but what I would say for sure is you don't want to miss one, because they are very, very dramatic. Within 24 hours, they're very, very dramatic. And also, although we say navicular bursa penetrations usually occur in the middle third of the frog, that's assuming that the nail went in straight in. Of course, a nail could go in at any angle at all, and although it may be not in what we would consider the danger area, you don't know which way it's penetrated the foot, so it could be not in the danger area, but it's actually heading towards the navicular bursa. So
wonderful, thank you, Chris.
And bandaging.
Thank you very much, Chris.
You're very welcome.
I'm going to pass you over now to Ian, one of the other directors at B&W.
Yeah, well, I just wanted to say a couple of thank yous. Firstly, Chris, thanks very much for giving the talk. But then I wanted to take the opportunity to thank Lee, not only for hosting this meeting, but also for all the work that he's done for B&W vets and for you as our clients, because unfortunately Lee's leaving at the end of this week and taking a career break, and you'd have to say it's a well-earned break if you consider all the work that Lee has done for us since he joined B&W back 15 years ago, just as we joined with W to form B&W there. But Lee knows the door is open for him to come back if and when he's ready to do so. But I also wanted to reassure you that we've got a wealth of experience waiting to pick up the reins and look after your horses there. Not only Chris and myself, we've got other experienced colleagues, but also on Monday we have a new vet joining us, Hannah Al-Tamimi, she's a local girl. She grew up in Monmouth and the Forest of Dean, and she's a horse owner. And before coming an equine vet, she was an animal behaviorist and had her own business. So we're looking forward to her joining us. Obviously very sorry to see that Lee is going, and making sure that he's aware that the door is open. So the message is, please do continue to phone us and we'll do what we can to help out. But Lee, obviously, thanks so much for what you've done for B&W and all yours and our clients.
Thanks very much, Ian.
Thank you. You've been a great colleague, and I'm sure we'll keep in touch.
Thank you very much, all. And thank you very much for everyone who's joined us this evening. I really do appreciate it. Thank you very much.
Thank you. Take care.